Okay, we're going to get started. We're going to be going over food safety and quiz 2 for this week. Basically, the only things you have to do this week are you need to get ready to take your quiz. And I'm just going to hit on some of the food safety items, and there's going to be no discussion questions or no assignments for this week. Your goal is to get chapters 20 through 24 done. So here's what we're going to be covering in food safety. I'm going to go over this in a nice good clip, and you just need to really go through your book, okay? So I want you to know that there are different causes for foodborne illnesses. There's bacteria, there's viruses, and there are parasites. And the goal is that you actually are using temperature to kill bacteria, viruses, and parasites in your food. So the temperature usually is around 160 for bacteria, viruses, and parasites to be killed. So that's the reason why we use food thermometers in our food, and we pasteurize our milk and our apple juice, and we want to make sure that we take care of our lettuce. It's because of the bacteria, the viruses, and the parasites that can be passed on in food. One of the big things that they do is that FDA and USDA are the two big regulatory agencies. So they're in charge, the USDA is in charge of meat, poultry, processed eggs, and FDA is in charge of all other foods. The state regulates shellfish, and then some state and local governments regulate stores, restaurants, and institutions. Our local government, the health department, does restaurants and institutions. So USDA has the bigger budget. It regulates 20% of the food, and they have very detailed laws on regulation of meat. FDA has a smaller budget and less authority, but get this, they regulate 80% of our food. Yikes. So they have less authority and a smaller budget, and they regulate more of our food. Anyway, imported food. More than 80% of seafood is imported, so a lot of times we get seafood from outside the United States. And then 50% of our fresh fruits are imported, which, even though we live in California, think about it. When we're out of season with certain fruits and vegetables, you'll see from Chile and from other areas, because they're importing like grapes that are in season in Chile. Because think about this: when we're in winter, they're in summer, and we're in summer, they're in winter. So we're on different sides of the globe. And then 20% of fresh vegetables are imported. So we have safety measures called the Hazard Analysis Critical Control Point, where it reduces it really focuses on procedures instead of needing to inspect food all the time. There's something called a radiation, where you actually use radiation to kill bacteria, parasites, and pets. Refrigeration is important, and the key number here is 40 degrees. That's a good test question, isn't it? Heating is important too. It needs to be above 140 degrees. Another great test question. And for meat, it can go all the way up to 160, and you'll see sometimes 180, okay? And then CDC does surveil for foodborne diseases, like with FoodNet and PulseNet. I can't stress that I'm going to really come back and ask you about the degrees and the heating temperatures. And you should care, because if your refrigerator is not at 40 degrees, then you do not have a safe environment. There are additives and contaminants that we have to watch for. So we look for, EPA looks for pesticide residues, for hormones that we call endocrine disruptors. Remember those? They actually can get in to our food, and they can disrupt our endocrine systems. Not good. We don't want estrogen in our food. Antibiotics that actually cause antibiotic resistance, because we can get exposed to raw meat that has an antibiotic resistant. We get exposed to a bacteria that's developed an antibiotic resistance, and then we have a bacteria that cannot be killed with antibiotics. So that's the reason why we do not want a lot of antibiotics in our food. Organic foods is something that we're starting to move forward to, and we're really starting to look for additives and trying to decrease those, because the more additives that are put in there, they can prevent diseases, but they can be used for improving color, flavor, and texture, but they have to be approved by FDA or GRAS. So Here's something I want to put out there. With the FDA and with food additives, sometimes you might find that you might be allergic to certain food additives too. So it's very important to be aware. Drugs. Drugs go through an approval process. They have to be approved by FDA beforehand. So they go through something called trials and clinical trials, and then they do post-marketing surveillance. And yes, money does have something involved in this, and this is a whole nother class, the FDA and our drugs. But yeah, I'll just stop at that. Right. So FDA monitors our drugs, okay, and what's approved and not approved. But I have a question for you. Are the drugs that are in Lawson's, like the hormones and the vitamin supplements, are those approved by FDA and Lawson's or in these herbal stores? And the answer is no, those are not FDA regulated. Cosmetics are loosely regulated by the FDA. There's no requirement for safety testing of cosmetics. So what you put on your face and what you ingest, those are not regulated. And we found that some ingredients are actually harmful. That FDA has food and advertising, they have to be advertised. And they started to put daily allowance for nutrients because, you know, sometimes people, if you get DEAK, those vitamins, potassium, vitamin E, vitamin A, and vitamin D, you can actually consume too much of. So they started to put recommended daily allowances on there. And then they started to ban trans fats in food too. So FDA is in charge of labeling and advertising. So they started to pass this Dietary Supplement Health and Education Act. And it forbids FDA from regulating herbs and food supplements. Again, FDA doesn't regulate herbs and food supplements. So that means that what you buy for herbs and food supplements is not being monitored. They can only remove a substance if it's been deemed harmful. So for example, Ephedra was removed after many deaths. So then they passed a law that requires supplement manufacturers to report serious adverse effects to FDA. So if someone dies of a supplement, now they're mandated to report it. But that kind of puts the mandate to report with the person who actually did the supplement. So you could see that we could have a conflict of interest here. So I guess the takeaway from this is to be very cautious about consuming herbs and food supplements as they are not FDA regulated. So just be cautious when you go into it. There's a lot of politics with the FDA. They're under a lot of pressure. People say the complaints are too slow in approving drugs. They say drug companies pay a fee to speed up the review process. And that FDA is too cozy with the pharmaceutical companies. And then many drugs are found to be unsafe after approved for market. So we've got drugs out there like for antidepressants for children. They found that children who are taking Prozac were more deemed to attempt suicide. So, you know, they started to put cautions on Prozac and some of the things with children. Fen-phen, you might have heard about that. That was a dietary pill. Problems with the way clinical trials are reported. They start saying that there need to be more databases. So there's a lot with the FDA that's been pushed back on. I want you to look at each one of these discussion questions because it might turn up in the quiz you will be taking. Identify 3 or more types of food contaminants. How is the government regulated to reduce the hazards of these contaminants? What measures can consumers take to further reduce each contaminant? Choose a package. I want you to look at it and read the label. How healthy is this food? And look in your book for the food guide pyramid. I want you to talk about the pros and cons of the Dietary Supplementary Act that basically said that FDA couldn't restrict. I told you about the cons. What about the pros? What were the benefits of that? Do you think all clinical trials need to be regulated by law and registered at the start and the results should be made public? And discuss your reasons for that answer. And then take a look at the FDA website. What are the hot topics the FDA is dealing with? How many warnings has the FDA issued? And how many recalls has it recommended over the past month? So look at all 5 of those questions and get ready for them, because I'm going to pull one, definitely will be on your quiz.